The Kinesiology 350 Health and Wellness Promotions class is more than a simple lecture notes, projects, and test class. This class has a service learning designate, meaning that this class incorporates the community engagement pillar of MSU's public affairs pillar. For our service learning, we learned about the economic makeup of the entire city of Springfield. We, as students, often see the best and brightest sides of what our community has to offer. However, just north of campus is a very economically depressed community, Grant Beach. This neighborhood is plagued by low income, low education, low health, low economic opportunities, and low nutrition, to name a few key issues.
Our class was divided into small groups, which would learn about one key area of depression in an attempt to improve it in some small way through education, material resources, and community engagement. Our group was then tasked with the improvement of healthcare. This is a large area, and we decided to narrow our scope for more specific and deliberate objectives.
Our mission is to provide the facet of oral health hygiene promotion to the overall wellness programming of the Fairbanks, and its mission of community engagement and impact through underserved urban neighborhoods. Our goal of this group is to distribute oral hygiene kits to children and parents of the Grant Beach community to increase education access and knowledge of the oral hygiene.
We had several objectives ranging from immediate to longer-term impacts. Our first objective was a learning impact objective. We defined as increasing the knowledge of 85% of attendees to the Boys and Girls Club Community Day on April 11th, 2015, by giving presentations and educational materials.
Our second objective was an environmental impact objective, which was defined as improving the home environment of the participants of the Fairbanks Community Day on April 11, 2015, by giving oral hygiene kits to 70% of attendees. Our final objective was a behavioral objective. 6 months after April 11th, we hope to see a 10% increase in teeth cleaning and maintenance procedures of residents of the Grant Beach community at Jordan Valley and other reduced and free service centers. Our priority population for this project are the families who have children that attend the Boys and Girls Club in the Grant Beach area. About 68 participants attended the health fair at the Boys and Girls Club on April 11th. We attempted to collaborate with community partners to gather materials for hygiene kits to give each child as they leave the health fair. We wanted to provide information on preventative oral care and provide education on what resources are available in the community and where to attain services.
Our main intervention was a pamphlet inside the hygiene kit titled How to Stop Zombie Mouth. The zombie mouth prevention was cited from a government resource which included music videos, interactive materials, and other educational resources. In addition, our pamphlet included information about where to get free and reduced oral health services nearby. We also discussed the benefit of having good oral health.
Our pre-measurements were based off of knowing government statistics which correlated general community income with oral health issues. We found where Grant Beach fell on the spectrum and assumed that the oral health to be similar to the national average. We did not do direct or even indirect measurements, but we built off an assumed national correlation. Had we had time, we wanted to actually gather data from every local free and reduced clinic and ask them how many patients they serve from the Grant Beach neighborhood. But that proved to be a much more monumental task and involved quite a bit of HIPAA red tape. Our post measurements can only be taken from attendees at the Community Day, so we do not have much data. Had we included questions about what the recipients learned about oral health, we may have had more data. Additionally, we will be leaving this class soon, so our opportunities for a longitudinal study are limited. In the future, classes may be able to fight through the HIPAA red tape and actually find out general trends of the dental problems and regular cleanings for that neighborhood.
Lack of communication in the process of organizing our resource and intervention was very frustrating. We believe it would be our responsibility to organize materials and find community partner sponsors. However, much of that work was done as soon as we began planning. Our main resource of groundwork was assembling the hygiene kits.
At the Community Day, we believed that we would have the space and opportunity to do a mini presentation and actually discuss our pamphlet. However, due to space and volume constraints, we were unable to, and our pamphlets were just put inside of the kits. We do not know if those resources were actually even looked at or used.
We do not feel like we made as big of an impact as we could have since our pamphlet was just thrown in the bag with all the other things, and we don't actually know if that intervention resource was actually used. Additionally, we feel that we could have made more of an impact by actually being able to present our material. Finally, we feel that a lack of communication cut off a majority of the legwork on creating the kits, and we feel like we did not do as much work as we expected.
We are unsure if our intervention or the program itself will have a community impact, but again, government research shows low-income communities with an active all-ages community center over time have lower dropout rates, lower crime, increased income, and higher university attendance rates.
Despite our individual setbacks, the Community Day event reached many families. We passed out many hygiene kits, increased awareness of the Fairbanks, and the Fashion Forward event gave children new outfits. The Fashion Forward event increased self-worth through providing new clothing and pampering the children. They also were able to present themselves self-confidently in a social setting and show them that people care about them.